Hello, my name is Javon Barwari, and today I will be presenting my Plan Change project. My title of the project is The Opportunity for Additional Hospice and Palliative Training in Nursing Education. So, as far as the problem identification and significance of problem, so, palliative care needs in our healthcare system have really heightened in the last decade due to aging population, as well as the number of patients with terminal illnesses. Nurses play a very crucial part in providing palliative care, and unfortunately, numerous nurses today have insufficiency of knowledge as well as assurance. This can cause practice division in physical and as well as psychological care of terminally ill patients. End of life education can really amplify students' understanding of the principles of palliative care and can also prevent them from developing any misapprehension from early clinical care and experience. Hospice and palliative education in nursing programs also can promote better quality of care for the end of care patients. And most importantly, the positive effect that hospice training has on the hospice patients is a significant drive to improving palliative education in nursing programs. Hospice patients can also really benefit greatly from nurses that have quality palliative care education and can also provide really good quality care. Now, as far as the EBP project question, so my question is for nursing students working with palliative and hospice care patients, what additional education implementation to improve the quality of care can be adopted and compared to traditional current nursing curriculum within 2 days? Now, starting with the review of literature. So, starting with article number one, which is an article from PubMed, and the title reads Undergraduate Nursing Students' Perception of End of Life Care Education Placement in Nursing Curriculum. And as far as what this article and study is about, the study utilized a combination method strategy to assess students' belief on the placement of end of life care education within the curriculum and their experience of having received the ELNEC training previously throughout their program. Now, what this training is hospice and palliative training program that they put into this study to see if how the students feel about end of life care before and after this program was implemented. Now, senior level nursing students' beliefs on the placement of the modules in the curriculum were isolated. And so one third were at the sophomore level, one third at the junior level, one third at the senior level. Now, the findings found that students who have obtained EL and EC training cohorted throughout the program, reporting feeling comfortable with providing end of care after graduation. So they reported feeling very comfortable with providing end of life care after that training was implemented. Students also reported that the training assisted them to gain understanding into the key elements in the palliative care, to acknowledge differences and similarities between palliative care and hospice, and to also recognize the nurse's role in palliative and hospice care. Now, as far as the themes that were extracted from the students' suggestions, they suggested that the quality and consistency of instruction needs to be enhanced, that the palliative care education should be delivered using various methods, and also methods to assess education and on palliative care should be improved. Now, as far as the second article that we will be reviewing, the title is Nursing Professionals' Attitude, Strategies, and Care Practices Towards Death, a systematic review of qualitative studies. And those are the authors below right there. So, the purpose of this study was to investigate the attitude of nursing professionals towards death. And the design that they use a systematic qualitative review method And the methods that were used was searches that conducted with PubMed, Web of Science, Cumulative Index to Nursing, and allied health literature, also queued in databases. So it all included 17 articles that they reviewed from. Now, as far as the findings, so 13 categories emerged, which were grouped into three themes: meanings and feelings during the dying process, coping strategies in the face of death, and the importance of training, experience, and providing a dignified death. So, in this study, many important findings were evaluated. And in the different accounts of nurses, it was found that death had a large negative emotional impact on them. And nurses, it mentioned that they're concerned about the insufficiency of prior training to care of dying patients, and that the bypassing these composite situations was one of the strategies most commonly used by healthcare professionals to face the death of a patient, because they felt like they did not receive enough training. And so the only way that they can kind of, you know, um, kind of work with these emotions is to basically um, bypass the complexity of the situation. So, as far as the third article, this is the effectiveness of of life nursing education, training on registered nurses, educational needs, and providing palliative and end of life patient care. And the authors are there right below in blue. So, as far as the purpose of the study, it focused on exploring the effect of professional development intervention within registered nurses on their educational necessities and providing palliative and hospice care. And as far as the design, they used a one group pre test and post test design. A convenient sample of registered nurses completed a electronic survey, and it contained demographic questions and end of life professional caregiver survey as well. So, the professional development intervention, it included an 8-hour training, and it conducted a content expert on palliative care that addressed the competencies developed by end-of-life care nursing education as well. So, as far as the findings revealed that there was a significant increase in participant knowledge and providing quality palliative care to patients. Now, education programs on quality and palliative and end of life patient care can greatly improve the care delivered to the patient population. And this is also a finding that the article concluded. Now, as far as the summary of evidence, so nurses play a very big role in care of hospice patients, and palliative end of life care is a very essential skill nurses need to master. And there are common discrepancies in undergraduate education, and graduates continue to report feeling very unprepared for this part of their work as a nurse. So, hospice and palliative education is a very much it's a need of improvement in nursing programs to better improve the quality of care for hospice patients. And it's also been reported by nurses in these articles that additional palliative education has made them feel more comfortable and has prepared them to care for hospice patients, especially the studies that included included hospice care and palliative care training into the study. So though these researchers utilize different methods and had various goals and purposes of the studies, they all had the same idea of highlighting the importance of including additional nursing education and on palliative and hospice care, as well as the lack of knowledge in these areas that affect the quality of care that terminally ill patients receive. Okay, so as far as the action plan, So there are three alternatives to addressing this issue. So one could be an implementation of a 2-day seminar on palliative and hospice education. Now, this will require speaking to and meeting with the director of nursing programs throughout the Southern California and kind of presenting this idea to the programs, including the benefits and significance of the 2-day seminar. This seminar can include clinical simulations and can also include nurses that have prior experience in hospice and can give a better insight on nursing for nursing students on the hospice and palliative care. And this can also be included in the geriatric course as a requirement. And the second alternative can be an additional residency program for palliative and hospice care facilities. Now, in Southern California, there are a few hospice residency programs for hospice care and palliative care, but they're very little. And I don't think that they're very well known either. So, residency programs for palliative and hospice care facilities for nurses, the ones that are there have really shown to improve the overall knowledge and confidence for nurses interested in working in hospice facilities. And then third would be an addition of hospice rotations and nursing programs as a requirement for clinical hours. So this can really enhance the knowledge of nurses when it comes to providing palliative care. And nursing programs have many different clinical rotation requirements, such as OBGYN, pediatrics, medical, surgical, and the list goes on. However, there isn't really requirements for hospice care and end of life care. So, that would be a really good addition to nursing programs, is including the hospice rotations. Okay, so my recommended best practice would be the 2-day seminar in nursing programs that covers palliative and hospice education, and it will be included as a requirement of the geriatric course that is included in nursing programs. And palliative care has many different complications and information and really important things that are very important and crucial for nurses to feel confident in their education and training and to be able to have the best care possible for these patients and for these hospice patients. So I believe that this recommended practice would be a really good addition to nursing programs. Now, as far as the policy and protocol for change, for the practice change, the policy would be reforming of nursing curriculum to enhance palliative care education of nursing students. And there would also be an implementation of a 2-day seminar on palliative and hospice education, which will be included as a requirement of geriatric course that is required for nursing programs. And the protocol would be at least 16 hours of education completion with 2 consecutive days. Now, within this seminar, nursing students will be educated on hospice and palliative care eligibility guidelines, ethical and legal issues involved in end of life care, ability to properly console patients and families, pain management and comfort care, psychological aspect of terminal illnesses. So, as far as the implementation plan, so first you would meet with the director of nursing programs and suggest an addition of this 2-day seminar. You would then develop a plan to include the 2-day seminar as a geriatric requirement for the course. Then you would provide proper education and training. You would then evaluate feedback and regularly update and revise protocols and evaluate feedback from nurses as well as new grad hospice nurses who have attended this 2-day seminar. Now, as far as an evaluation plan, so after the implementation of this 2-day seminar, the plan would be to survey nursing students on their readiness of hospice and palliative care after the completion of the seminar. Also, a survey for new grads in hospice as well as in critical care that have completed the attendance of the seminar. You would also, as an evaluation plan, include to offer opportunity for feedback from director and dean of the nursing program. Now, as far as the evaluation consequences, so this implemented change and 2-day seminar can really be successful, and it can present a higher confidence and knowledge in nursing students on palliative care. And the plan can really have potential to be highly effective and significant in nursing education and curriculum. The statistics and evidence that present the idea that hospice nurses are not comfortable and confident in their knowledge on palliative care due to the lack of education received is really what facilitated this change. And alternative approaches may also result in positive outcomes. So, for the future use and to improve education of nursing students, all three of the approaches mentioned can really help facilitate the change and even further can help create a positive outcome for nursing students. And these are my reference pages. And I hope that you enjoyed my presentation, and thank you so much.